Thanks for joining in on the Clinic Talk, our podcast. Today, I have a very special guest, Dr. Sally Fryer Dietz. She is from Dallas, Texas, and her company is Integrative Pediatric Therapy. Dr. Sally, how are you?
Good. How about you?
Good, very good. Thank you for joining us today. I'm actually very excited because I know you do pediatrics and you have a few books that you're working on. So I'm actually excited to learn about that, and I'm sure viewers are as well. So introduce us, give us a little background on yourself and who you are.
Okay. Well, I've been a physical therapist specializing in pediatrics for actually over 40 years.
Wow.
Even before I became a physical therapist, when I was in college, I was a child development major and I've worked with kids. I taught preschoolers. I did, all different kinds of child development things in school and volunteered at hospitals. And then when I got out, I was very driven and directed to go into pediatric physical therapy. And I've been there ever since. It's just been a passion that's worked out great in my life and been very rewarding on many, many levels.
That's awesome. So that's pleasant to hear, that it's a rewarding career that you had over all these years. So did anything kind of push you to be pediatric therapy, or is it just something you felt kind of within yourself that that's what you wanted to do?
Well, it's interesting. When I first, filled out my college applications back in the early 70s, I didn't have any idea what I wanted to major in. And I was looking through the list of, what do you want to be when you grow up? And I saw child development. And I thought, I love working with kids. I've always, worked with kids in high school. I, taught classes and babysat and did stuff. So I figured, I'll just learn that because that will give me something I know about kind of. And so really I started in child development and I learned about physical therapy, somewhere in college. It wasn't any, particular moment in time, but somebody talked about physical therapy and what physical therapists do. And I thought, gosh, that sounds really cool. I wonder if you can do that working with kids. I'm sure kids have physical therapy needs. So that's where I ended up kind of going down the pediatric road. My dad really wanted me to be a pediatrician, and I really wanted to just work with kids and do the fun stuff. So, I always told him that I could always do that later if I wanted to, but really I knew that I was destined to become a pediatric physical therapist. And, fortunately.
Well, that's not too far off. Pediatrician and pediatric physical therapist, that's not too far off. You still are in the healthcare space helping kids, so that's still along the path.
Oh, no, I still think I got a better deal because I really, I get a really, in pediatric therapy, you get to see really the fruits of your labors. You get to be a part of an incredible journey and setting children up to be as successful as possible. And there's so many different avenues and opportunities to work with kids. And my practice as it is today is kind of a reflection of that. And I think continued growth in the field and seeing a need and fulfilling a need and continuing to learn, throughout, the entire, lifespan of your career. In life. So I'm still going strong after all these years. So
that's awesome. That's awesome. Good. And we're going to get into like your business and everything. But I do want to say I love that, that you mentioned you got a better deal because you actually get to follow the progression of the child throughout their lifespan, right? As opposed to pediatrician where, and I'm sure, again, they have a amazing career as well that they do. But with a physical therapist, and I'm an occupational therapist, by the way. So I know working with kids, you get to see them multiple times a week, right? As opposed to a doctor who gets to see someone, once a month or once every even couple months or 6 months or a year. So you get to actually grow with them and see them as every step of the way with their milestones. So I love that you mentioned that. So awesome. So tell us, did you ever have any business experience before, or your family? What inspired you to become a business owner?
So it's interesting. I worked in a hospital in San
Mm-hmm.
Francisco for 10 years. And during that time, I met a man who I ended up marrying, who was a physician. And we ended up moving to Dallas for his career. And
Mm-hmm.
I just had my first baby, and then I ended up having my second baby in Dallas. But I
Awesome.
I had only been a staff physical therapist, working. I started all different kinds of programs in the hospital, but I was very much entrenched in, working in a hospital based practice. I had never taken any business classes.
Wow.
I wrote the checks for the bills every month and that kind of thing, but that was
Yeah.
about it. When I was pregnant with my second child, my husband had he was in practice for himself, and he
Mm-hmm.
lost his office manager, bookkeeper. And
Mm-hmm.
so I wasn't working at that time, and told him, yeah, I would do that. So basically I taught myself the medical economics of his practice as a
Wow.
pediatric cardiologist, actually.
Hmm.
And what I realized in doing that was that if I ever went into practice for myself, I was never going to take insurance because it is a
Yeah.
disaster if you are
Yeah.
on
It's tough.
insurance
Yeah.
plans, even as a physician or a therapist or anything else. And
Yeah.
true to this day, actually, I do not take insurance. We,
Wow.
provide
Oh.
all the bills and everything for insurance, for parents to get reimbursed by insurance and out of network
Mm-hmm. Yep.
practice. But
Like a super bill, right?
yeah, but what I realized in that experience is that insurance companies, even though nobody ever likes to talk about it, they're really the ones that are dictating medicine. And people aren't supposed to do that. It's just the medical providers are supposed to dictate the treatment plan, what, a
Yeah.
person needs. And that's what works. That's where we have
Yeah.
success in therapy is
Yeah.
when the therapist, is really able to do and have the freedom to do what a child or an individual needs. So, in that early experience as, kind of the bookkeeper of a medical practice, that's what I came away with. And so when I
Wow.
did end up, deciding to start my own practice, I set it up where I was only going to take cash payment and provide people with the information they needed to get reimbursed. And, I started out very small. I had a little, notebook where I wrote all my appointments
Yeah.
and kept
Yeah.
track of the billing. And I, billed people once a month, back then. And, it was very, very simple in many ways, but I learned by doing, and I, grew to, have, it's a pretty big practice. I have, had about 20 therapists, PT, OT, and speech for a
Awesome.
large part of it. And we kind of fluctuate around 25 now, but, there's a lot of
Awesome.
moving parts
Oh, yeah.
but it's always a work in progress.
Awesome. Awesome, Sally. That's amazing. So from bookkeeper to practice owner. And I love how you brought your experience from your husband's practice where you did not like insurance dictating the therapy, well, for the visits, and
Yeah.
you
Yeah.
incorporated that to the practice you have now. And
Right.
again, I completely agree with you. And I know a lot of providers that are going to be watching this are going to agree because, even I know you do pediatrics, but it's across the board. Even
Right.
with adults and geriatrics, these co-payments, right? And I hear this a lot, because like a patient that needs therapy, they're going to make a decision financially based on their needs, right? So if they have
Right.
co-payments to pay every single visit or deductibles or co-insurances,
Mhm.
whatever it is, they're going to say, well, you know what? I don't need that therapy. But in
Right.
reality, they do. And we as
Right.
therapists and healthcare providers know that they do. But unfortunately, if they can't afford it, or sometimes they can afford it, but it's still in their mind, like, oh, I'd rather use this money somewhere else. And I've heard it.
Right.
I've
Right.
done a lot. Like I've done pediatrics. I've worked in skilled nursing facilities, home care, and I hear it all the time that the family members they kind of get together and then they make a decision for the needs of the therapy based on their copayment and insurance.
Right,
and that should not be. As you
right,
said, it should not be. It should not be dictated by insurance. But unfortunately, that's the reality. That's,
right,
where we live. That's how it is. That's how medicine right here is.
right,
But I love the fact that you took your experience and your passion, it seems like, to know that you want to treat people based on their need, and you kind of
right,
took that insurance piece out.
right.
So that's awesome. I applaud you for that, and I'm sure there's many others
Well,
that would love to do that.
yeah, it is. It ends up being really a win-win for everybody because
100%. Yeah.
when somebody is paying for a service,
Mm-hmm.
first of all, as a provider, it's my responsibility, no matter what. But you really feel it when you're the provider with a private pay to provide the
Mm-hmm.
absolute best care that you can, because
Yes. Yep.
that
It's what
person
we signed up for, right?
has to see value in what they are paying for.
Yes.
And when
Yep.
they do, it perpetuates itself because you're able to give the patient what they need. They're seeing
Mm-hmm.
value. They're getting better. Their child's getting better, and everybody wins. And then they still can go back and get reimbursement, but it's not me waiting 6 months and paying
Right. You got to
somebody
run a
to
practice.
track down. Yeah, I don't have time for that. I don't
Of
like
course.
that part of
Yeah.
therapy. I like
that's
being the doing the hands-on work.
right. You want to treat. You want to see, the progression of your goals that you're setting up for, for the kids. So
Right.
that's awesome.
Right.
That's beautifully said. So I appreciate that. So let's talk a little bit about the practice then, right? So when did you open the practice? What year was that?
So here's where it gets really personal.
Yeah.
And that was in 1994 when my firstborn was about 5.5 years old.
Mm-hmm.
And he was at a private school here in Dallas. And the teachers started saying that they had some concerns because he didn't want to do some of the things they wanted him to do. And he was very smart. He did a lot of things really well, but he got distracted. He would do what he wanted, not what everybody else wanted, which is kind of a hallmark of ADHD. Well, he wasn't alone. There's a lot of kids out there who are super smart, bright kids who really there's nothing wrong with them except that they're drawn to do certain things because they're more comfortable for them. Yeah. And so their world can be a lot more narrow than, a kid who's a little bit more easygoing and, doesn't have a lot of sensory motor things that might be getting in the way of how they're doing stuff. So I was married to a doctor at the time. I'm not anymore actually, but back then I was, and he, wanted to, I took him to a pediatrician, developmental pediatrician who recommended put him on medicine, put him on Ritalin.
Wow.
And it was like, my gut was like, he doesn't need to be on a medication. But what's
5 years old, you said?
5 years old.
5.5. Wow.
Yeah. I mean,
and that was the first instinct.
Uncommon. It's not uncommon, but it's getting better. There's more awareness now because we have therapies that are getting way more attention than they used to be. And this is, again, 1994. So that's 30 years ago.
Yeah.
And so anyway, well, first I took him to the pediatrician. He put him on the Ritalin. That made him depressed. He became very, very focused at school. The teachers were very happy because he would sit there and zone out and do what they wanted him to do. But he would come home, he would explode. He was quiet and introverted. And, this kid who was so, bubbly and, rambunctious all of a sudden was, not the same child. So I took him to a developmental pediatrician who said that, well, yes, he, has ADHD, but I think he also has depression. So let's put him on a different stimulant and add in an antidepressant. So now I've got two doctors putting him on medications.
Different.
That, I still was not, again, I'm in this medical family. And so, the emphasis on allopathic medicine and medications. And, this is my baby. He's my firstborn.
Yeah.
He's a little kid. And so I took him to an educational tester who tested him and said, yes, he, confirmed again that he probably has ADD. Nobody mentioned sensory integration deficit, although he acted a whole lot like the kids I used to work with in San Francisco. And we did sensory integration therapy in San Francisco.
Yeah.
But there was never any mention of that. And so she said, well, the best thing you can do is take him out of the private school, put him in a public school where he won't be as noticed and he can do his own thing. Well, I'm like, okay, so that doesn't make sense either. So you want me to dumb him down, put him in a different environment so nobody pays attention to him, so he's not a problem. So that is why I opened my clinic. I opened it for him.
Wow.
And, but I also knew, because I had done sensory integration therapy in the past, that I could not be my child's therapist. So I hired an OT who did pediatrics. I had her work with him, and I worked with other kids. I actually started originally with a good friend who was a counselor who did work with kids on social skills and all kinds of stuff. And we came together and went and looked for a place and set up, we called it North Dallas Developmental Specialists back then. So we had four specialists, physical therapist, myself, social skills counselor, which is what she did, pediatric occupational therapist, and then a speech therapist. And that way we were really the first practice that had a multidisciplinary group where we could see kids that could meet all their needs. Because really, it's never just one thing. In my child's case, it was his handwriting, supposedly. And it wasn't just the handwriting. That was just a symptom, of a bigger problem. But, there were some expressive language things that, he could benefit from. And, there's different specialties have different things to offer. So we started way back then in the old days, 1994, with this multidisciplinary group, and it really just grew from there. But that's where we started. Yep.
Awesome. Thank you for sharing that. Yeah, thank you. That's listen, that's a reason you want to kind of start something, and it was from your passion and personal experience, and to help your own family. So that's, I think, amazing.
Yes. And I think, too, that what happens is so many times children get misunderstood, and they get pigeonholed.
They're children, right? So,
into a diagnosis. And way too often, and again, it's changed a little bit, but it still happens. Way too often, the first thing people do is medicate. And, it's really been a passion of mine to educate on that there are other options to pursue first. And if you need medication, you need medication, but doesn't it make more sense to try and support the nervous system as naturally as possible first? And then down the road, if you still are having trouble where you can't learn, then talk about medication. But
absolutely, no, 100%. And I think what happens is when you give medication first, now you're kind of like zoning out the problem, and now you can't even treat the initial problem, because you might actually have some other symptoms. So, it's kind of like, a headache or something. Like a first symptom of a headache, people taking medication, but it could be, they want to treat it another way or find the underlying cause. So, but yeah, thank you for sharing that. That makes absolute sense why you opened up a practice. And I love that you took the approach of a multidisciplinary approach. And that's why right now your practice is called Integrated, right? So that because everything's kind of integrated, you have and I call it the trifecta, the OT, PT, speech, right? Because we all work together to accommodate the goal of the kid or the older patient. So that's awesome. So tell me, or tell us, how did your business progress? Like when you started, you actually started right away with, you hired a OT, right? And you had speech, and you mentioned you have 25 providers now that you're working with.
Right. Wow. We've gone from, a little one gym where we shared, we treated all in the same space, to 10,000 square feet.
Wow. Amazing.
So it's
Amazing.
a lot bigger now than it was. Yeah.
Yeah. Wow.
That's
And how
over
do you,
30 years. So
no, that's amazing. Listen,
yeah,
that's a huge space. In New York, that's going to cost a pretty penny.
I know.
Here, I don't know about Dallas prices, but that's like a warehouse in New York here.
I know.
That's
Well,
awesome.
things are changing now. Now I'm kind of, we'll talk about that later, but I'm, changing things a little bit, and
Okay.
you got to
All right.
change with the times,
Of
as you
course, you
go
got to
because
adapt, right?
of how expensive things are.
Yeah. So tell us, so your therapists that you hire now, are they full-time? Are they part-time? Are they contractors? What does that look
So,
like?
so I've kind of done everything. Right now, I have primarily full-time therapists, and
Mm-hmm.
that happened over COVID. Before COVID, I had, part-time and full-time, and really it was, wherever we had the kiddos and whoever had the time available, um, we were able to see everybody. And
Mm-hmm.
what I found was you do a whole lot better if you have full-time therapists. Better in the
Mm.
sense that you've got people who are there who are really kind of 100% invested in what's going on. It's
They're
hard for
focused.
somebody
Yeah.
who comes in maybe one afternoon a week to feel like they're really a part of that group. And we have a super, super tight, very well educated group of therapists. I mean, I couldn't be happier with all the people I've gotten to work
Awesome.
with over the years and who I still work with today. I still have people who were my first hires who are still with me.
Wow.
So we
That's
really just
awesome.
kind of grow.
Like
But
a
as you
family.
know, yeah, it is like a family. But if you're in
Yeah.
pediatrics, one of the things that attracts people into pediatrics is we have a majority of young women who
Mm-hmm.
are just getting married and starting their own family. And
Mm-hmm.
so when you do that, you don't want to work full time. So it's a balance between uh, being able to work as many hours as you can, but not take away from your own
Yeah.
family.
Yep.
And so it's kind of a full time hybrid with some part time thrown in there.
Okay. That
Depending on
makes
where
sense.
people,
Yeah.
where they are in their lives, and a
Absolutely.
lot of times when they have their babies, they work part time for a couple of years, and then they come back full time when the kids are in school or they have more time available.
Yeah.
So
And that's part of, like, I think the culture that you're setting as well, that you're allowing them
right,
the flexibility, to adapt it to their own personal needs, and then they still can come back. So
that's
so
right.
I think that's cool. Awesome. So but how do you hire therapists? Do you have always a need to fill like a role? Do you have a lot of referrals coming in, or are you stable and it's based on need?
I think that is probably one of the hardest things that as a business owner that I have to deal with are finding really good quality people.
Yeah.
I have been very, very fortunate in that I have great therapists, and they are
Hmm.
very stable, and they typically don't leave, unless they have a
Awesome.
baby or they move, or something comes up that is
Right.
just part
Not that they're jumping
of
job to
life.
job, right?
Right. Right. I don't have where somebody works for 6 months and then they decide they don't like it and they go somewhere else. I mean, they really,
Yeah.
people stay. But I'm always looking for, if somebody comes along who I get a really good feeling from,
Hmm.
I will I will try my best to make a place for them. If there's any
Awesome.
way I see that growing. Um, I had a therapist, I mean, many years ago now, she's still with me. She has 4 children now, but back then she had no
Wow.
children. And she,
Yeah, that's crazy.
yeah, and
That's awesome.
I just really, I just got a great feeling about her. We kind of had, you can teach anybody skills, but you can't teach anyone how to relate to kids and be a good
Hmm.
communicator. So when
Yeah.
you find that in a person, it's worth hanging on to them. And then, if you need to build up skills, you can do that. But in this case, she had a specialty working with scoliosis and the Schroth
Mm.
method. There weren't very many
Hmm.
people who were certified in Schroth. And in fact, I was not familiar with Schroth when I first interviewed her. But that was kind of her specialty. She really loved that. And I really, really liked her. And I hired her and said, let's see what we can do. And see if we can build up, Schroth program. What do you need? And we bought all the equipment and, she built it up. And we've got this
awesome.
Great, scoliosis program now. And, the same thing goes for lots of different things for feeding therapy. That's kind of how we got started with feeding. And when, a therapist has something they're really interested in, then, we'll look at it and see, do we have the need for kids to get that kind of service, and how can we develop that and help it grow and get the skills that people need to be able to be the best they can in those areas. So, long answer to, if I see somebody who's got somebody they have to offer,
to bring to the table, you take them.
Yeah, then let's see what we can do. Yeah.
Awesome. So thanks for sharing that. So as far as your therapists go, are they all W-2 employees? Are they 1099?
They're all employees. Yes. Yeah, they all have. I offer continuing education. We do. It works best. I have my supervisors. Some in admin team were on salaries, but most of the therapists prefer to be on a per patient basis, so that they can schedule their own schedules. They have a little bit more flexibility that way, as long as they, are able to get the kind of hours that they need. So I try and work with everybody so it's a win-win for everyone. I believe a lot in continuing ed, so I put a lot into educating my staff and making sure that they have classes that they're interested in, that they can help develop their skills and stay excited about the profession that we're in.
Awesome. No, that's good. You're doing a great service then to the industry, making sure they still have the passion. So that's awesome. So let's talk a little bit about referrals. Like, how do you get your referrals? Because listen, employing 25 therapists, right? That's a lot. So how do you get your referrals? So
most of it is word of mouth.
I love that answer. It's like my favorite answer when I hear that. Word of mouth is you can't beat that, right?
It really is. It's other parents. I do education. I do a lot of free education, talking to schools, giving in-services on, the different therapies we do. How can teachers work with kids in their classroom to help support individual differences? Trying to bring more understanding into pediatrics and child development and, growth and development and learning and behavior and all those kinds of things, and being a resource to the community. I would say we get most of our patients are from other parents and from teachers. We have to,
from the
in Texas. In Texas, we have to get a doctor's order still, though, which is really
interesting.
Funny. California, I have a California license, and I can just put a shingle on my door and do whatever I want under my license. But even as a doctor of physical therapy, I have to rely on a physician writing a treatment order. And there are still some pediatricians who, not many, but every now and then there are some that just, they don't support therapy for whatever reason. And then it's a little more of a challenge. You have to, talk to the doctor,
educate, right? So, but
other than that,
I'm not surprised. I got to say, I'm not surprised, because I hear the same things also from older geriatric, these, some of these patients are 90 years old, they need help for like walking and stability, balance, self-care. And then some of the doctors don't sign the plan of care.
It's like, why not? What do you have to lose? I mean, what do you think you're doing to support this person? It doesn't make sense.
I don't know. Maybe, so one doctor I know mentioned that, they don't trust the therapist to not make things worse.
Oh,
But that also makes no sense because, listen, we can provide another therapist if you don't trust that therapist, but it has nothing to
right,
do with who. It's just the fact that that piece of paper has goals written on it,
right.
and they're like, oh no, I don't think those goals are needed. Um,
Yeah,
you know, so yeah, it gets crazy. But again, we have to follow the guidelines, the state
right,
insurance
right,
rules. In your case, at least you don't have to follow insurance rules because you're not taking insurance.
right.
So it makes things easy on your end, as
Yeah,
opposed to many others who, unfortunately, they don't have a choice. A lot of
right,
private pay in different areas. There's not many people that can afford private pay.
right.
So it's a challenge, but it's great to be in a demographic where you can actually fill a void and a need. And as you
Yeah.
mentioned earlier, it's a win-win, right?
Hmm.
So that's great. Okay, awesome. So you got the referrals down. It doesn't sound like you have a problem with that, so that's amazing. So do
Yeah.
you do any marketing? Anything
Well,
like
my biggest marketing was
mailers?
writing.
Yeah.
No, no, I don't mail anything out. I don't put ads
Digital
out.
marketing?
I have
Nothing?
a
No ads?
website. I have a couple
Ah,
websites. I have
yeah.
website for pediatrics and website for concussion therapy
Yeah.
that we actually ended up branching into. And then I've written 2 books. But I give those books to all the families that come to us. So if they come
Wow,
in for
that's awesome.
evaluation, they get a book, and it talks about just different aspects of child development and sensory
Hmm.
integration therapy and how the sensory systems affect learning and development.
Wow.
Checklists for red flags, when to worry, what you can do, how to support kids. And my latest book is Sensory Processing Solutions, Drug-Free Therapies to Realize Your Child's Potential. And, that's the little book.
Wow.
But,
Awesome. Yeah, definitely.
but
We're gonna tag that book. And what was your first book? What was the title of your
it
first
was
book?
When Kids Fly, Solutions for
Oh, I
Sensory
love
Integration
that.
or
I
Sensory
love that name.
Challenges. Yeah.
Wow. Okay, we'll definitely tag your books. Are they on Amazon for
They're on
purchase?
Amazon.
Okay.
Or, pretty much you can get them anywhere. Some bookstores carry them, Barnes and
Cool.
Noble, stuff
Very
like that.
nice.
So.
Awesome. So it sounds like, you're wearing, or you wore at least a lot of hats, right, for your business. So what hats are you wearing now?
So my latest hat is I is kind of a funny little niche. So I do a therapy called craniosacral therapy, and I'm
Mm-hmm.
a diplomat certified craniosacral therapist, and
Wow.
we're seeing lots of different. We see patients from all over the country for craniosacral therapy. We even have people
Awesome.
from South America who come to see us for craniosacral therapy because we're
Nice.
all certified therapists and we're all PTs or OTs.
Mm-hmm.
But in that, I was seeing a lot of babies. And it
Mm.
was a lot of babies with feeding problems, nursing problems, plagiocephaly, torticollis, all of our developmental milestone things that we were doing. And so I wanted to get more into the lactation aspect of breastfeeding and how I could support these moms better because so many moms were coming out of, again, this is sort of post-COVID, coming out of the hospital with no direction on or guidelines for feeding. They were over swaddling babies. We were seeing this huge
Wow.
increase in plagiocephaly and torticollis. And I wanted to know better. So I became a lactation counselor. And
Ah.
so now we do, and that's really one of our biggest, fastest growing programs because
Wow.
there's such a need working with moms. A lot of lactation consultants will refer patients to us, because if breastfeeding becomes a bigger problem than what the lactation counselor can provide, the craniosacral therapy is such a great adjunct. And when you can do those things together, it's just, it's
Amazing.
almost like a
Amazing. Yeah.
little miracle. Yeah, it's really great. So that's kind of my most current passion. That's
Awesome.
been
So you're
a lot
still
of fun.
very involved in actual care. Do you do
Yeah.
anything from the administrative side? Do you do like billing or
So
scheduling?
yeah, I actually very fortunate. Again, I have a great staff now. I have an administrative assistant, business manager she works with parents and helps them with billing so they can get reimbursed. And I have 3 other administrators who do all the scheduling and facilitation, getting all the paperwork out and back into the therapist, and kind of interface between, therapist and family to get them on the schedule and do all that. Most of the families we see regularly every week, once or twice a week. And so, once a therapist has their schedule, but we've got new patients that are coming in, and you always have, reevaluations and evaluations and stuff. So, a good admin team that backs up all the therapists.
Listen, it's our team, our staff that makes the business go around.
Absolutely. They're the ones that answer the phone.
It's a blessing. It's really a blessing to have an awesome team. Like, even for us, like, we do have a practice, but from like a software perspective that we run, our EMR, it's our staff, right? Our team, it's also a family that makes everything run. So I encourage everyone, when they're starting a business, or even if they're already have an existing business, make sure you keep your team happy, because they are essentially what will make you successful and less stressed out, right? Because listen, as a business owner, there's so many things, so many different avenues that you want to put your mind to, and, you want to do this, do that, right? Yeah. But you got to be grounded. You got to make sure that you have a good support system. So cool. So just in closing, tell us or tell others, what you would recommend for them if they wanted to start a pediatric practice.
Oh, let's see. I would say, find a space that you can afford, that's easy to pay for.
That's important.
And where you're not going to have the stress of, when I first started, I thought, if I don't see enough patients, I guess I could do birthday parties, because I created this big gym with lots of
event space.
All the place. But I'm so glad I didn't have to do that. That would have driven me crazy. But, find something that you can afford, and surround yourself with people, like-minded people who you feel like you want to work with, and, be happy with what you do. Do it, for the right reasons. Do a good job. So many times people get lazy and just do the status quo, and there's just no room for that in our profession, whether you're a PT, OT, speech. We have a responsibility to, make this world a better place, I think.
Yeah, that's 100%. That's why we got into healthcare, right? So, unfortunately, the industry is tough too. There's a lot of burnout with documentation and productivity and all of that. So it's important to find your space as a therapist. And it sounds like in a practice like yours, where you actually, you take care of everyone, you give them flexibility and a good team to work with. So that's appreciated. Awesome.
I do have to share. I want to share one last thing, and Absolutely. That is that little kid who I started my clinic for, my son, who was 5.5, is now a prosecuting attorney in one of the largest DAs. He's an assistant DA, and grew up to be a very successful
amazing
debater in court. So
amazing. I'm sure he's proud also to know why you started your practice too. So
and he has 3 little kids that he's getting to be a dad to now, and follow the same same kind of thing. So
awesome.
They do grow up, and we do great work, and it's it's so rewarding when you do it the right way.
Absolutely. Cool. No, thank you, and congratulations to you and to him. That's awesome. And just the last question for you: what is your long-term goal for your practice? Is it to keep growing it? I was going to say leave it to your kids, but it seems like they're successful doing something else. So what is the long-term goal?
Well, the nice thing is, again, that little kid who grew up and is the attorney is married to one of my occupational therapists.
Wow.
Who does the OTs.
Awesome.
And
awesome.
They had to move away from the area for a while for work for him, but they're coming back. And, my long range goal is, hopefully to have her be involved for a long time.
Cool.
I love what I do. So I don't see myself retiring anytime soon, but I'm getting up there in the years, and I'm not working as many days as I used to. And
yeah.
And I like to, pick my challenging little patients that I see and do things. But our building is being sold and torn down. So we're kind of being forced to look at, other
space
places to go live. And I've been in the same space for 30 years. So that's a hard.
It's like a landmark now.
It is a landmark. Everybody knows where we are. But I think I'm probably going to maybe, decrease our footprint a little bit. We do a lot of work in the schools. We have clinics in lots of schools. And, but I want to, maybe we go into the homes more and help parents, set up little gyms at home and sensory opportunities for kids to do more at home and have more transference between the clinic and home, and not as much in the clinic space as more outreach and more integrated into, the home. So, that's kind of where
I love that too.
I think we're, sort of easing into. We'll see what happens. I like change.
Awesome.
I like.
Yeah, it's exciting too, right? Because there's also a need. Listen, in the home, I did home therapy, and we also work with a lot of home-based practices that therapists go into the homes, right? In New York, there's so much population of need for therapy, whether it's pediatrics or it goes all the way to end of life, right? So it's such an important need as well for therapists to be there in the home, because that's the patient's domain. That's right. It's where they are for the most of the day, and that's where they function. So if you can make adaptations there, that's invaluable, right? So that's awesome. I'm glad you're receptive to that change. And listen, it's unfortunate that you're getting kicked out, but it sounds like you have an optimistic outlook on it, and you're willing to adapt and roll with it and grow with something else. So that's awesome.
Yep. We'll just see what happens. Yeah. So
awesome. All right, Dr. Sally, thank you very much for your time. It was a pleasure learning about you and your practice. Again, it was an amazing, inspiring story of how you are and why you became therapist. So we wish you the best, and I hope to speak to you soon.
Oh, good. Well, thanks so much, and to you too. Okay.
Thanks a lot. Take care.
Okay. Bye.